Michigan's governor is sounding the alarm, saying her state needs more vaccine doses as cases surge there. Nearly 6,900 residents in Michigan have confirmed COVID cases as of yesterday. Hospitalizations also on the rise. Nearly 24 hospitals in Michigan have reached 90% capacity. Joining us now, two Michigan doctors on the front lines. Dr. Liam Sullivan, an infectious disease specialist at Spectrum Health in Grand Rapids. And also with us, Dr. Matthew Sims, Director of Infectious Disease Research at Beaumont Health, that is in Royal Oak. Good morning to you both. And Dr. Sims, let me begin with you for your personal experience, having been in the hospital in Michigan, having seen what was set up there and how they were dealing with the beginning of the pandemic to now, to yesterday. As I understand it, you saw more COVID patients than ever before?
Well, I wouldn't say than ever before, but I think I saw the most COVID patients I've ever seen in one day.
Okay.
At our hospital. It's busy, and it really does remind me of how things were last March, last April, with the number of patients who were coming in, with how busy our COVID units are, with the stress that everybody's being put under to care for these patients.
And Dr. Sims, just to follow up on this, you say you're seeing younger and sicker people. Yes? Talk about that.
Yeah, so as you know, coronavirus, the COVID, targets the older population more than the younger population. But there's been a concerted effort in our state and in most states to vaccinate the older population first. And also nursing homes have put in more policies and procedures to really try to protect their residents, to prevent COVID from spreading within their facilities. And because of that, it's limited the number of older patients that have really become infected in this surge. As such, more patients are younger, between the ages of 30 and 50, and they do seem to be sicker. A lot more seem to be needing oxygen. A lot more are requiring some of the bigger drugs that we're using now to try to treat it. About the same in terms of needing to go to the ICU, but a lot of that's because we've learned a lot that it's better to not intubate than intubate most of the time. So we're willing to let them go with a little less oxygen in order to keep them off the vent.
Dr. Sullivan, you are also seeing these younger and younger patients. You call it the perfect storm of reasons. What is at play here?
So I think it's a multitude of factors coming into play here. I mean, number one, the state's opening up a little bit more over the last couple of months. Then number two, I think people are very fatigued and tired of all the restrictions and masking and distancing and avoiding our crowds. You know, I call COVID fatigue, as everybody's referring to it. And then you have B117 coming along, which is a strain that's just at least 50 to 75% more transmissible than the other coronavirus strains that were previously circulating in the state of Michigan. And it's now become the dominant strain in the state. And therefore, I think that it's created a perfect storm, and people letting their guard down, et cetera. The virus is taking complete advantage of the situation and rapidly spreading throughout the population.
Talk more about the variant, the B117. And one of the things that I've noticed is that you're seeing it at youth sports. You're seeing this being passed around, much more transmissible at youth sports. I care deeply about that, as my 14-year-old boys are soccer players. Is this a situation now where an activity that they may have done 10 months ago is more dangerous today than it would have been then? That doing the same thing is no longer an option?
I mean, I think potentially it's a little more dangerous only because this strain is so much more transmissible. You know, I don't know if it's the actual activity itself that's creating the issue, or if it's more the activities that go on around the sports that's creating it. You know, the gatherings before and afterwards, the carpooling, you know, the team parties, et cetera. Those are probably the things that are probably driving the spread of the variant more than the actual sport itself. You know, and I know in Michigan there's been quite a few outbreaks linked to sports activities. You know, and this strain. One of the other interesting things about this strain is we're seeing it a lot more in elementary school kids. I mean, they're not getting hospitalized, obviously, but we're seeing a lot more cases in elementary school kids because it is so much more transmissible from person to person. And I think that's a little concerning, and that's a change from previous.
That's really concerning as the mother of two little ones, and you think about all the people they come into contact with who could be hospitalized if they're not fully protected. Dr. Sims, just to you on the governor's plea there for a surge in vaccine doses from the Biden administration. The administration so far is saying no. What do you need?
Well, obviously, more vaccines are better. The more vaccines we get into people, the more protected those people are. But it takes time for the vaccine to work. If we were able to immunize everyone in Michigan today and give them the booster shot in 3 weeks, it would still be 5 weeks before everybody is fully protected. So it's not enough to just say we need more vaccination. We also have to take more care to avoid spreading the virus. And that's masking, social distancing, avoiding crowds, all of the things we've been saying to do from the beginning.
Dr. Sullivan, Dr. Sims, we thank you both very much for being with us. Thank you both so much for the work you're doing, or wish you the best of luck in the coming days and weeks.
Thank you as well.